Hello everyone, my name is Prim Poshyanonda and I'll be talking about the project I have been working on this summer with Dr. Morrow, the Patient Narrative Project. This project aims to investigate whether narratives about patients accomplishing self-care improve self-care intentions and planning among older adults with diabetes. The 4 stages of the study is recruitment, the first interview, data processing and creation of narratives, and the evaluation, or the second interview. A lot of research into narratives and barriers to self-care for diabetes patients has been done prior to this study. However, the study that has the greatest influence over this project is the Bojinga et al. 2017 study. This study talks about the 4 steps to constructing health narratives called the story bridging approach and demonstrates it by creating health narratives for Dutch truck drivers. The results demonstrate that after reading these narratives, their health intentions had improved. It talks about the importance of involving the target audience in the creation of these narratives in order to have the intended effect. Our study aims to emulate this process by interviewing diabetics and getting their feedback in creating fictional health narratives about them overcoming barriers. The first stage in the study is the recruitment. We will be recruiting older adults with diabetes through the iHelp database. I will be calling them and using this script and questions to judge whether they match our requirements for this project. In the screening call, I will also be giving them a speech discrimination task where they will have to get 80% or more correct. For the next stage of the study, the first interview, they will have to answer a demographics questionnaire, as shown here. There is some basic information as well as some of the questions relating to their health literacy and preferred medium to use. After that, they will have to answer an intender questionnaire. The process of this questionnaire is to know whether our participants have accepted their illness and are maintaining self-care plans and have faced and overcome their barriers. The last step in this interview is to ask them a series of questions which will be around an hour long. This interview is recorded and the information is what we will be using to create the narratives. An optional focus group for participants that have internet access will be conducted with similar questions. The next stage is where I'll be transcribing the recordings and creating the narratives using the story bridging approach. Dr. James Graumlich will be reviewing these transcripts and narratives for any misinformation. The last stage is a second phone interview with the participants. They will be given the narratives and give us feedback. We will be using an immersion questionnaire adapted from DeGraff et al. 2012 for this purpose. Our future plans are to use these narratives we had created and have more participants evaluate them and test the effect towards their health intentions. Thank you.